Just to let you know, I just want to tell you this. I was a member of our state board, and I actually served for 15 years on our state board, and I served every single position, including president of the board. And I'll tell you, from somebody who is an outsider, I think you should give H&S a big round of applause for everything they do. Because they're on top of it, and hey, anytime you want to come to Illinois, let me know, okay? All right. Okay, so we ended off with the Lenny codes, and so now he's collecting royalties, and that's why he's not sitting here anymore. I heard he's on a plane for Cabo, something like that, so you too can make it rich in ICD 10, okay? So I know this is not in your notes here, and it doesn't matter. I put that in just to show you some of the examples of how ICD 10 is going to work. And if you look at this here, what I've been teaching you so far, you'll see up in the corner, the left-hand corner, it says S16, okay? Now, S16 is injury of muscle, fascia, and tendon at the neck level. So S16 is, if you will, what we were talking about, the family, okay? Now, there are other definitions here, such as excludes two, and I'll go over that in just a second. And then you want to look back to the AD and S, okay? In the big book, it will have the codes, and then it'll talk about, like here, S16.1XXA. And it will guide you back to the family, if you will. And when you are looking up codes, you may wish to look at the family of codes. Not every code requires the A, D, and S. So when we are looking at some guidelines, and you will forget what I'm teaching you, most of the stuff, okay? So, you know, the video is good, but you got to go back and look at the book as well. In the big book, it will have something like this. The Chiral Code book will have it. In my book, it'll say requires a 5th digit, a 6th, or a 7th. Anytime it requires a 7th character, it always will have an A, D, or S. Now, the family, the root, if you will, the family is an S code, okay? Now, don't confuse it with CPT codes. During the break, during lunch, somebody asked me about orthotics, and as they're talking, you know, it dawned on me because we talk about codes, and they were talking about modifiers, and we have right and left modifiers for certain codes. Is that going to be affected in the ICD-10 system? Probably not, because those modifiers, if you think about it here, any modifier you're thinking of, the 25 modifier, the 59 modifier, the AT, the GA, those all go on CPT codes. They don't go on ICD-9 codes, or 10. So the systems are different, and you don't want to interchange them. Just like the S code, when we talk about S, you might say a HCPCS code of S8990. All right, which is for, you know, maintenance care, but this S code up here, the S16 codes are diagnosis codes, and an S code, and this is something that you should be aware of. It's not just a piece of trivial information. The S codes are from the S chapter, which is chapter 19, all right? The S codes kind of take it, and in your data bank of fast tips, if you will, that's something else good. That'd be one fast, you know, tips or frequently asked questions for the H&S website. So, and I'd be happy to, I haven't done that for anybody else, so I'd be happy to help you out there. But the S codes there, almost always, the S codes, when it comes to ICD-10, require 7 characters, all right? The M codes, you know, Mario wants to make it easy, so the M codes don't require the A, D, or S, all right? So the S codes are the Lenny codes there, okay, the Leonard codes, they're the A, D, and S, all right? He's shaking his head no, but you guys will remember that, okay? So AD and S, and you'll see here, and look at where it says S16.2XX, and then there's a blank line there. Well, that line is because it's going to require an AD or S. So no other codes have a blank line down there. And even in my book, it has a blank line down there, okay? So again, think of it as new problem, active care, all right? D is probably going to be more like recovery/rehab, although for Medicare that probably won't happen. The S is definitely for sequela, okay? So in these type codes here, that just gives you an example of how to tie everything else in, okay? So when you're thinking about the seventh character, the codes there, you're going to ask yourself certain questions, and this here you can take and use that now, even though the clarification will come about, the clarification will focus the picture later, but is the patient receiving active care? And the answer is yes, it's probably an A code, okay? So is the patient in the middle of an active treatment plan? Yes, so that is probably going to be a D type of character there. Has the patient's condition stabilized? Stabilized, probably going to be an S, all right? Now, I say probably, but that's just the way it's evolving, all right? Is the patient receiving supportive care? And again, what is supportive care? By definition, supportive care is where the patient receives care to prevent deterioration of a chronic condition. That is considered a subheading of maintenance therapy, and by most insurances is not a covered service. In other words, wellness care by itself is where and I'm talking Medicare, but Blue Cross, everyone has the same definitions now, and wellness care is if you want to prevent a condition. But once the patient has a chronic condition, scoliosis, degenerative disc disease, spinal stenosis, now when the patient has to come in every 3 weeks or else they're going to get worse. That is considered supportive care. It is a subheading under maintenance care, and in many instances, if not all, it is not covered. So therefore, is the patient repeating? And so you don't have the questions in front of you. It doesn't matter. All you got to do is write down active treatment, seventh character, active treatment A. Okay? In the middle, subsequent encounters, probably a D. Supportive care, S. Sequela, S. Is the patient in a healing or recovery phase? D. All right? Is the patient being treated for a complication that is a direct result of some other condition? That is probably going to be an S. Okay? And so that just helps to drive home what I've been teaching you here for the last 45 minutes of this class. All right? Now, there are exceptions with the seventh character, although you're going to use them very rarely. And, I looked through all these exceptions, and none of them really are chiropractic scope of care except maybe gout. And there, with tophus or without tophus, that's a 0 or a 1 as a seventh character. I wouldn't even worry about it. I'm not worrying about it. Why? Because how many patients are you in your practice treating for a primary condition of gout? Okay, probably not that many. Okay, so I wouldn't, when you're thinking about the seventh character, okay, so seventh character is usually with what chapter? Chapter, what number? 19, and those codes start with a what? S. Okay, all of them do. So now, and is that going to be in your practice? Yes. That's a big portion of your practice. Okay? So when you think of it that way there, don't bog down yourself with 0 or 1 for gout, because that's just not going to be something you see often. Okay? Now, when we look at some of the definitions, the brackets are used in the list that gives you synonyms. All right? And so there, alternate wording is present, and so when you look up definitions, and again, this won't be everybody here, but when you look up definitions, it may give some synonyms for that. Now, that is nothing different than what we see in ICD 9, the brackets. However, here, the includes and excludes, the includes is in ICD 9. You use it already, it's just you don't know. So this note appears immediately under a 3-digit code title to further define, clarify, or give examples of the content of the code category. What does that mean? Well, it includes all these conditions. So here's an example. Patient comes in and they fall off of a stage. Okay, I keep watching. I don't want to pull a Madonna here, okay? So they, she fell off a stage recently, never mind. Okay, all right. So includes, now, if I fell off the stage and I broke my hand, okay, if I have a fracture to my hand, is the abrasion on my hand anything of consequence compared to the fracture? No. And so in this case here, the abrasion is probably going to be deemed as one of the symptoms or the findings along with the fracture. And so therefore, you will not code the abrasion since the fracture is the main thing you're treating, okay? Okay, so what did I tell you? A sprain injury, okay? If a patient has a true sprain by your definition where they lifted something, okay, would you expect there to be spasms with that sprain? Sure. So therefore, you're not going to assign a sprain code along with a muscle spasm code because the spasms are a symptom of it. That's all that says, okay? But now excludes 1 and 2, this is different for ICD-10. This is something new that you will use here, okay? And what you want to think about when it says excludes 1, it's when 2 conditions may not occur together. And I'll give you examples coming up here, okay? And so what they're saying is it's either you're going to do this one or this one. Okay? So this condition excludes these other conditions. And so if you look at those codes there, and I do have that in my book as an example for those of you that have it, you're going to see that it excludes these conditions. So therefore, you don't use, in other words, if I have sciatica, then I am going to use the sciatic code, but I'm not going to put in a lumbalgia code because that is excluded. In other words, you don't use sciatica with back pain and lumbalgia at the same time because it's already included. Does that make sense? Are you guys with me? Okay, there's sciatica. There's sciatica with leg pain, without leg pain, with back pain, without back pain. So if you're using sciatica, leg pain, with back pain, it's all one code. So then it excludes lumbalgia as a diagnosis because it's already included, okay? Now excludes 2, this is brand new. It's not in ICD-9. Excludes 2 says you don't have to use both, but you can. And so excludes 2 says that it indicates not included here, although the condition may be part of. Here's an example. Excludes if you have diabetic neuropathy and diabetes. Those 2 can be put in together. That's one of the examples of excludes 2. Now, the reason why I'm telling you this here is because these you will want to know. You're already using bracket codes in your practice. There are other definitions, the and, or definitions you're already using in your practice. It's just you learned it a certain way and somebody wasn't giving you the definitions as I am. Okay? But excludes, those are different here. And so excludes 1, what that means is basically either or. Okay? So an example, excludes 1, you can only use 1 code. And so I put this in, this is new, but it doesn't matter. You can take notes. You have the excludes slide with your notes there. So excludes 1, use only 1. It's mutually exclusive, okay? So put that as a note. Excludes 2, is that you may use two or more. And that's one good way to remember it, is excludes one code. Excludes two, you may use two codes along with it, all right? And so it's really simple. If you just learn that, then you don't have to memorize, definitions here. It's just you learn the way to use it, okay? All right, so here's an example, and I know it's kind of small to see, but nonetheless, we'll do it, okay? So the S33, which is dislocation and sprain of joints and ligaments of the lumbar spine. And then you'll see where it includes. Well, it includes the avulsion of the joint or ligament of the lumbar spine, laceration of the cartilage, sprain of cartilage, traumatic hemarthrosis of the joint, traumatic rupture of the joint or ligament. In other words, what is another name for a traumatic rupture or tear of a ligament? It's a sprain. What's the root of all this? A sprain. So they're saying is that it includes all that. It's pretty simple if you think of it that way. But the excludes, well, here excludes one means you're going to use one or the other. So non-traumatic rupture or displacement of the lumbar intervertebral disc. Okay, so take this here now. Now think of it, just think of it. And I'm more into just thinking about things, because if you understand it, you don't have to memorize it. Okay? And so if a patient has a sprain injury, let's use my example of the guy at Bob Evans. He's getting out of a booth, he hurts himself. Okay? And so he hurts his back. He has a sprain injury of the back, I told you. I suspected that he has a disc herniation, but I didn't put it on the claim form. Why did I not put it on the claim form? Because I didn't have an MRI or CT scan of it. Very good. Okay? Now, he's not getting better. In fact, he's getting worse. So now I do an MRI, and it shows that he has a herniation of the disc, all right? So is the sprain injury anything to worry about compared to the herniation of the disc? No, it's like the herniation of the disc trumps everything, right? Correct? Yes? So now you're going to diagnose the herniation of the disc. Nobody cares about the sprain injury. It just says how the accident happened. That's the excludes one. Now, the excludes two is dislocation and sprain of joints and ligaments of the hip. Well, this is of the lumbar spine and pelvis. Is the lumbar spine and the pelvis, doctors, when you think of pelvis, do you think of the hip? Is the hip truly a pelvic bone? No. You see, the pelvis is like the SI joint, the ilium, the ischium, all right, the pubis, whereas the hip is a different joint, and that's why if they injured their pelvis, they might have injured their hip along with it, but it's not the same, so I can use them together. I can say they sprained the SI joint and they sprained the hip joint, and it's two different things. In fact, if I adjust the SI joint, what code is that? If I just adjust the SI joint, it's a 98940. If I adjust the hip joint, the true hip joint, what code is that? It's a 98943, you see? And so it's different things, and that's why we look at it as spinal and extraspinal. In the example here, the reason why excludes two, which means you can use how many codes max? Two. Then I can put in there a dislocation of the hip, which is a sprain of the hip, all right? And so I'll use those codes like the S73, and yeah, I'll have to go back and look at the S73 codes and then look at the hip. Now, you'll see a line after S73. What does that mean? It means that there's many different codes under the family S73. And without even looking, I can guarantee you that it's an unspecified sprain of the hip. We have right hip, we have left hip, correct? And then we have all the ligaments of the hip that are specific right and left. So there's a plethora of codes, isn't there? Right? Okay. Does that mean a little bit more to excludes 1 and 2? The main thing I want you to understand right now is in your practice, number one, how many of you treat a sprain of the hip itself? Okay, a couple of you raise your hand. So you're going to look up these hip codes. All right? But, if a patient comes in and said, I fell down the stairs, every time I take a step, it's hurting in my hip joint. I mean, right here in the front. Okay, do you have any pain back here? No, nothing. It's all right here. Oh, and I can hardly stand. Okay, what are you going to do? If you're going to say, okay, let's take a look at this, and you're going to treat it, that's the hip. If you say, you know what, I'm going to, if you take x-rays or if you send them out, then that is the sprain of the hip. You probably will never use it if you're going to send them out. Now, what I did here is I just had you think about the scope of your practice. It's not the scope of chiropractic, it's what do you treat in your practice. If I have a patient come in with a hamstring strain, I feel very comfortable, or with a knee problem, feel very comfortable because in my practice, I'm a CCSP, diplomate in pain management, and we do rehab in our office. I can treat those things. Some doctors, chiropractors, they said, I primarily stick to the spine and pelvis, okay, as an example, okay? So I just want to allay your fears a little bit, is look at your practice, and if that is something you treat, then you want to go into and get your playlist a little bit bigger. Your playlist may be 20 songs, 20 codes, or it might be 100 codes depending on the scope of practice. Is there anyone here in a multidisciplinary practice where you have medical doctor, PTs, or whatever? Okay, because there, and in fact, I just had one in last week in the class there, and now you've got tons of codes you're going to be dealing with. Okay, all right, very good. Any questions on that? All right. So again, the S13 as an example there, the S13 is the family. Now, I gave you an example that you wrote down, S13.4XXA, and so now that is one of the cervical sprains. Okay? Excludes 2 is a strain of the muscle. Okay? So now, in this case right here, what we're saying is it's a sprain of the joint. Okay? And so, doctors, I'm asking you now, and I know I'm being a little bit more technical, but this is why, is doctor, is a sprain and a strain, are they the same things? If the patient has a strain, i.e. muscle damage, are you going to treat it differently than you would for a sprain injury? Okay. Of the sprain and the strain, which two are the most important or the priority diagnosis that you're going to treat? The sprain, so therefore your sprain always goes first. Okay? Whatever is acute goes first. Whatever is worse goes first. Okay? Everybody got that? You see, if you think about it, and if I just presented to you those guidelines there, you would be sitting here thinking, oh my God. You'd say, is this another Medicare Advantage program? Okay? No, I'm just kidding. Okay? All right? But if you think about it here in your everyday, the stuff you do in the office now, it's not that hard, and it's like you're already following the rules, it's just nobody told you you're doing the rules. Okay? All right. Okay. Now, code first, use additional code. There is a definite sequence that we have to use on these codes, all right? Now, this right here, you probably are doing it, but I know there's somebody in the room who's not doing it right, all right? And I want to change that pattern. It's kind of like I have a squirt bottle, and every time you do that, like I do to the dog and the cat, I'm going to squirt you in the face, okay? All right? Okay, so code first, and I was teaching this class in Maine, okay? And somebody raised their hand in Maine, and they said, why do I feel I need a lawyer to interpret this, okay? Well, this was the guy who probably was, out in the lobby half the class anyway, and I held my Italian in me, okay? I didn't tell him what I really thought. But then it came to me about the sequencing of the code. And I already asked you this question as well, but when it comes to Medicare, what code goes first in Medicare? the subluxation, except in Florida, because you actually get denied if you use the subluxation code for Medicare in Florida. You really do, okay? Florida, Puerto Rico, yes, I did have to teach for them in Puerto Rico. So code first means this is the sequence of code. Now, if you don't know the following that I'm about to teach you, please commit it to memory. If you only remember 10%, make sure this is in that 10%. It's very important, okay? All right. Code also alerts the coder that more than one code may be required. So let's talk about it. Here are the hierarchy of codes. Highlight this, know it down, okay? All right. So you can look at it now. Just look at me for a second and just listen. I'll give you the Mario story, and then you won't have to memorize, okay? All right. So if I were to make a problem list is all the problems that are present. All right? Now, staff that are here, raise your hand real high so I see you. Real high. Okay. So staff, what you're going to know from now on is that if the doctor were to write out a problem list, it's not necessarily the sequence that the list will be placed in. Here's an example. Okay? A doctor I was working with, she wrote down a problem list. Her staff didn't know any better, and they coded those problems, which is fine, and they put them in that same exact order. Now, doctor, if you're a hotshot doctor and you know your stuff, you're going to put it in the right form in the first place, but staff, we're a team. And just like me, you know, I'm pretty anal in my office, A-N-A-L, okay, it's French, okay? I speak some French too, okay? And especially when I'm mad. And so my staff, they may question me. Like when I ordered therapy and Laura looks at me and says, she's 3 months pregnant, it's like, oh yeah, okay? And I didn't know that. That's why we have staff to cover our SI joints, okay? All right, okay. So when the list is written here, if you take that problem list and now you put it in the right order, it's like when you're dealt cards, okay? And you put them all in the same suit or whatever it might be, all right? You're putting them in order. So therefore, currently, this is ICD-9, by the way. That's why it says it up there. If you have a choice, you always put neurologic first. Sciatica, brachial neuritis, whatever it might be. Okay? Now, if you have a structural problem, an example, and you can write these examples next to these in your notes here, a structural problem would be scoliosis, degenerative disc disease as an example, DDD, or DJD. By the way, there is a difference between DDD and DJD, right? Okay? In Medicare, you may not have realized this, but of the approved codes that are there for a chiropractor to use, DJD is not in there, not of the spine. We can treat DDD, but not DJD. And I have seen on 2 occasions now where Medicare asked for the notes, and they said the notes do not support the diagnosis. And the doctor was using DJD in his notes, and the diagnosis was DDD. He meant DDD, degenerative disc disease, but it didn't support it. So again, make sure you're using the right thing. DJD, degenerative joint disease, does go along with DDD, but not necessarily. DDD is where you have dehydration, thinning out of the actual intervertebral disc. Functional diagnosis. How many of you do rehab in your office? Anybody here? Okay. All right. So here you are, and you want to let's go to the rehab club. All right. And so you knock on the door, and they open up this thing, and they go, "What's the password?" Okay. And you'll say, "Lenny," and they'll go, "No." Okay. All right, and you go, what did Mario tell me? Well, functional diagnosis is done for deconditioning. And deconditioning, the code is 728.2. If you don't know that, that's ICD-9, okay? 728.2 is deconditioning of the spine. If you have deconditioning, you can now do rehab. Now, it's not always a primary, and so in ICD-10, deconditioning, what did we expect it to be? A sequela. All right? You got it? Okay, so here it is, deconditioning, usually as a result of something else. Maybe it's a result of a lumbar sprain. Maybe it's a disc problem. So I'm going to have 847.2, lumbar sprain, and then 728.2, deconditioning of the spine. Now, if it was me, and if I worked for the dark side, I could make so much money. I mean, I could have that Maserati out in the front, okay? All right? Instead, I've got a Chevy rental car. Okay, so anyway, all right, so, now, what's the password? Oh, it's deconditioning, 728.2. Oh, come on in, and there's a party in, okay? And the problem is patients, you know what the problem is with rehab, by the way? Patients actually get better, okay? That's like, remember Russ Earhart, for some of you that have been around like I have? Remember, he used to say the problem with chiropractic is people get better, okay? All right? So with rehab now, 728.2. Here's another one, okay? How many of you do trigger point therapy in your office? Raise your hand. I'm helping you out, okay? Trigger point therapy, all right? Now, this is where you stumble, okay? Because I always ask the question, why do you do trigger point therapy? And they all just look at me like you are. Why do you do trigger point therapy? For what condition? Say it. Trigger points. Duh. It's trigger point therapy. All right? So in order to do trigger point therapy on trigger points, you have to say trigger points are there, right? Yes? Just say hallelujah something, okay? All right, okay, all right. Okay, so 729.1, which is myofasciitis or fibromyalgia, that is the code that allows you to do trigger point therapy. If you don't use that code, you don't get trigger point therapy. And again, if I was working for the dark side, not there, denied. Okay? All right. So this is where your findings support the diagnosis, and the diagnosis then supports the treatment plan. And it all has to go together. Now, when the insurance companies are requesting records under ICD-10, do you think they'll be looking for that? 100% yes. Okay? But while the other guy down the street is sleeping on a lumpy mattress because they have gold bars under there, you're going to say, hey, I took Mario's class, no problem, right? Right? Okay, cool. All right, good. Soft tissue would be next there. That is your trigger point therapy. Then extremity, complicating factors always go last. Okay? All right, okay. So just write down hierarchy of codes, ICD-9. In ICD-10, it's called sequencing of codes. They just changed it. They changed, Rosetta Stone of ICD-10. Okay, it's coming out next month. Jenny will be selling that for me, okay? All right, okay, all right. So Rosetta Stone is like hierarchy is now called sequencing of codes. So the sequencing of codes, that is the order of the codes. Why does it matter? Well, in general, and I'm not speaking about any insurance company, but in general, Palmetto, they look at the diagnosis, and their diagnosis codes then will yield how many visits you get. Like in Medicare, is there any limit on how many visits you can get per year? No, there's not. Actually, there is. It's 365. It's one per day. All right? But you're not going to get paid that amount. So that's why you want to sequence those codes properly. Yes, the subluxation goes first, but then that's just the region. And then after that, then goes the medical diagnosis. And if you ever thought about it there, the subluxation, why do they require the subluxation first? Medicare, and Medicare has told me this, they require the subluxation first just to see if it's a covered service. After that, the medical diagnosis determines how much treatment we can expect that the patient is going to require. And so therefore, lumbalgia. Okay, if my back starts to give me some problems here, if I go sit down for an hour and rest, now it's gone. It's a short-term type of treatment. Whereas if I have degenerative disc disease, spinal stenosis, whatever it might be, now it's going to take more treatments than that. And that's why you are the doctor. You know how to diagnose. And you know what? Let's face it. In this room here, the doctors in this room, you and I, we know what's wrong with our patients, don't we? Don't we? I mean, I've told my patients, one patient went to Barnes Hospital in St. Louis, got an injection, and they're injecting the SI joint with pain management. And I told them, do you feel this right here? It was L4. She said, yeah. I said, that's causing your SI pain. That's why you're not getting better. Tell them it's the right L4 facet. So the next time she went in for a shot, she told them that. And you know what? They actually did a right L4 facet injection. Her pain was gone. It's because and I'm not anything special compared to all of you here, we're all the same, right? We know our patients, so therefore diagnose it properly. Don't just put down lumbalgia, okay? All right. Okay, so hierarchy in ICD-9 equals sequencing in ICD-10. If you understand that concept, it's going to go a huge long way, and it's not just so you get paid better, properly, more, whatever. It's so that you diagnose in the correct order, okay? All right. All right. All right. Okay, let's take a little test. Okay, you ready? You don't have to write it down, but just take a little test here. Hopefully these questions are the same as what you have. They might be a little different. It doesn't matter. Let's look at the mandatory implementation date for ICD-10 is October 1, 2015, we think. Okay, all right. ICD-10 contains how many chapters in the United States? 21. Very good. In ICD-10, the placeholder character used for codes that require a seventh character extender is, so what's the placeholder character? Pardon? X, yes, okay. The National Center for Health Statistics is responsible for clinical modifications of ICD-10. That's true. And then ICD codes start with a letter, except for the letter U. Okay, very good. You see? You all have 100%. Good. Pat yourself on the head. Okay, all right. Okay.